Hello, this is Dr. Stanley Lang, and welcome to this podcast on is it fibromyalgia or is it Lyme disease? And as I've talked about in previous videos on these subjects, fibromyalgia and Lyme disease, the question is often which one is it, or is it both at the same time? So the context for this presentation today is the idea of health in a whole person health approach, body of mind and spirit, and we're focusing primarily on the physical elements of health today. And I want to tell you about a patient that I saw today that was somebody that I've been treating for many years for fibromyalgia, and she's seen multiple specialists, and she's been basically considered disabled. And only in the last 6 months did it even cross my mind, is it possible that some of what she's dealing with is Lyme disease? And when I broached the subject with her, she was very interested. And so we started empirical treatment for Lyme disease, meaning she started antibiotic therapy and a few lifestyle strategies that I recommended. And this is in the face of a negative Lyme test. And for the first time in her last several years, she started to feel a lot better. She needed a lot less medication. Many of her pains went away. Some of her neurological symptoms went away. But after about 6 months, she wanted to stop antibiotics, and so she did. And about 6 months later, the symptoms started to come back, which is not at all unusual. When the symptoms of chronic Lyme disease start to go away, sometimes it is months before they will come back. Sometimes they come back within a couple of days after the person stops antibiotic therapy. When I saw her back, her symptoms were getting worse again, and so she wanted to start treatment. So I reviewed with her a new strategy that I have been making available to patients, which is a completely non-antibiotic strategy where the Lyme germ, then traditional antibiotic therapy. Now, in her case, she chose to start back on antibiotics. However, a second patient that I saw today with very similar situations in terms of elements of fibromyalgia, elements of Lyme disease, decided that she did not want to restart antibiotics. She wanted to use the natural approach because she didn't want the toxic or negative effects of Lyme disease treatment from antibiotics in her body if she could avoid it. So she chose the natural approach. Now, this approach also has been working very well with some of my patients. And the issue for you is if you have Lyme disease or fibromyalgia, or maybe both, the question is when you have a flare-up of symptoms, which one is it? And to help you to understand which way to go in terms of thinking about the options, I've created a survey that lets you kind of get a sense of what kind of things you should be looking at to decide whether a trial of treatment for Lyme disease is a reasonable idea. Now, why is a trial of treatment reasonable if you think you might have it? Well, because Lyme disease doesn't stay put. It can spread in your body. It can cause damage in other organ systems that it hasn't damaged before. It can damage your brain. It can damage your heart. And so a trial of treatment, when Lyme disease is a reasonable possibility, in my mind, becomes an increasingly good thing to do when the treatment is completely non-toxic. So that's the good news of where things have gone in terms of Lyme disease treatment. We've got some strategies now that do not require antibiotic therapy and work quite frequently very well. So I hope you found this information helpful. If you're interested in taking the survey, either click on the link on the video or beneath the video. I wish you well. God bless and have a great day.